Okay, you sent us this stack of sources, all focused on healthcare costs, how to navigate it, how to make it more affordable.
Yeah.
And let's face it, this stuff can feel, well, incredibly complicated, like trying to read a foreign language sometime.
It really can. It's overwhelming for a lot of people, but the material you shared, it's actually packed with really good practical stuff.
That's what we saw too.
Yeah.
So our goal here in this deep dive is to take all that material you gave us,
Yeah.
the articles, the data, those stories, and really pull out the key insights.
The actionable bits.
Exactly, the stuff that gives you those aha moments, makes you feel a bit more in control.
We're going to cover the whole range from your sources, starting with, like, why is it so expensive anyway? Then getting into strategies,
Yeah.
insurance, meds, prevention.
Right, and even some financial tools and maybe less common approaches.
So let's just dive in. The first big thing the sources tackle is that fundamental question. Why is healthcare just so darn expensive?
Yeah, where does all the money go? The sources really start there, highlighting just the incredibly high cost of everything. Services, treatments, even just the insurance itself.
Mm-hmm. And they bring up that statistic from the Kaiser Family Foundation.
Oh yeah, that one jumped out. Healthcare spending, up nearly 5.4%
Annually.
every single year for the last decade. That's quite a climb.
It's a huge trend. And the sources make it real, too. They use that example, the family facing a medical emergency.
Right.
They rush to the hospital, they get the care they need, which is great, but then that bill arrives.
And it can be staggering. Completely derail finances. It really shows the human impact.
Absolutely. It's not just numbers. So the sources then break down why. What are the drivers behind these rising costs?
What did they point to?
Well, several things. Technological advancements, for one. Think about, like, robotic surgeries, amazing stuff.
Definitely.
But the equipment, the training,
Wow.
incredibly expensive. And, that cost has to go somewhere. It gets passed down.
High tech, high price tag. Makes sense. What else?
The aging population is a big one. More people getting older, especially the baby boomers,
Right.
means more demand for healthcare services overall, and especially for managing chronic conditions, diabetes, heart disease, things like that.
More demand, more strain, higher costs. Okay. Any less obvious factors?
Well, one that really stood out in the material was administrative costs.
The bureaucracy.
Yeah.
Yeah.
The sources mention studies finding that up to, get this, 25% of total healthcare spending
Wow. A quarter.
might be just on the admin side.
Yeah.
Billing, coding, processing claims, managing the paperwork. It's a huge chunk before you even factor in the actual medical care.
25% just shuffling papers. That's kind of mind-blowing. You don't think about that when you get a bill.
It really points to, some systemic inefficiencies. And then, of course, there's pharmaceutical expenses, drug costs.
We hear about that all the time.
The sources note the alarming rise, especially for, like, specialty drugs for complex conditions. The price tags can be just astronomical.
Yeah. Those really make headlines. Anything else?
And finally, the sources do mention healthcare provider salaries. Obviously, skilled doctors and nurses need to be compensated fairly for, incredibly demanding jobs.
Absolutely. Essential work.
But those salaries are part of the overall cost structure. So understanding all these pieces, the tech, the aging population, the admin bloat, drug prices, salaries, the sources say knowing that why is really the first step.
Right. It gives you context. It helps you feel a little less lost in it all.
Exactly. You can't really strategize if you don't grasp the landscape. And speaking of strategy, the next big piece in the material you shared is your main tool, your health insurance policy.
Ah, yes. The document that often feels like it requires a PhD to understand.
Right, and the sources acknowledge that. They bring up that scenario with Sarah, who's confused about her coverage, almost missed needing a referral for a specialist.
Which could have meant a denied claim. Ouch.
Exactly. So the sources hammer this home. You have to get familiar with the key parts of your own policies. Sounds basic, but...
It's crucial. Like the premium. That's just the monthly cost to even have the insurance, right?
Right, that's your entry fee. Then comes the deductible. That's the amount you pay out of pocket for most things before your insurance starts paying its share.
Okay, pay the deductible first, then what?
Then you usually hit copayments or coinsurance. A copay is often a flat fee, like $30 for a doctor visit. Coinsurance is a percentage. Maybe you pay 20% of the cost. Insurance pays 80% after the deductible.
Got it. Flat fee versus percentage. And the network.
Yeah.
That seems vital, too.
Oh, absolutely critical. The sources stress this. Knowing which doctors and hospitals are in-network versus out-of-network.
Because the cost difference can be huge.
Massive. Going out of network can lead to surprise bills that are way, way higher, so know your network.
Okay, so understand the terms. But the sources also talked about using the insurance effectively, right? Maximizing benefits.
Yes, exactly. It's not just about knowing the rules, it's about playing the game smartly. The material had some great tips. First, take advantage of preventive services. Vaccinations, annual checkups, screenings like mammograms or colonoscopies. Often, these are covered 100% under the ACA, no cost to you.
Free care. And it catches problems early.
Which almost always saves money and obviously improves health in the long run, so that's a huge one.
What else?
Use telehealth services, virtual visits. For non-emergencies, they can save you time, travel, and often have a lower copay or fee than going in person.
Super convenient, especially now. Good point.
Stay organized. Keep records, appointments, bills, explanations of benefits, notes on calls with your insurer. It just makes everything easier if there's a dispute or you need to track spending.
Good discipline. Anything else?
And just ask about discounts. The sources mentioned asking about cash pay discounts if you can pay up front. Doesn't hurt to ask. Some providers might offer something.
Right. So the message from the sources is your insurance isn't just a bill you pay. It's a tool. Understand it. Use its features.
Precisely. It's about actively managing those costs.
Okay, moving from the big insurance picture, another huge cost area for many people, prescription drugs.
Oh, yeah. A major focus in the material you sent. And they go right at the generic versus brand name question.
Which saves people. How much?
The sources say generics can cost anywhere from 30% to even 80% less.
80%. That's massive. And the key point they made
is that generics have the exact same active ingredients. They work the same way. The FDA requires it. They're not like a weaker version.
It's just made by a different company once the patent runs out.
Exactly. They shared that anecdote about Mary switching from a $200 brand name to a $30 generic.
That's $170 saved. Every single month, maybe. That adds up incredibly fast.
It really does. So the bottom line is, huge savings, same drug effect, widely available. Just ask your doctor or pharmacist, is there a generic?
Seems like a no-brainer first step. But what if there isn't a generic, or even the generic is too expensive?
Good question. The sources also cover prescription assistance programs, or PPs.
These are run by drug companies or nonprofits?
Often, yes. And they share Tom's story. He needed a super expensive drug, couldn't afford it. His doctor helped him find a manufacturer's program.
And it helped?
Significantly reduced his cost, made it accessible. These programs can be lifesavers, literally.
So how do you find them? What did the material suggest?
Start with your doctor or their office staff. They often know the landscape. Check the drug manufacturer's website directly. Look for patient assistance.
Okay.
Look for nonprofit organizations related to your specific condition. They sometimes have funds or directories. And use prescription discount cards or websites. Things like GoodRx. They compare prices at local pharmacies and find coupons.
So multiple angles. Generics first, then PPs, discount cards.
Right. The sources make it clear. You have options to tackle those high medication costs. You just need to know where to look.
Okay, shifting gears slightly. Your sources also really emphasize the power of, well, prevention. Staying healthy in the first place.
Yes, proactive health management, which, as you said, feels more like an investment than a cost.
They talked a lot about regular checkups.
They did. Using Jake's example, someone who didn't love going to the doctor. But a routine checkup caught early high blood pressure, high cholesterol.
Before he had symptoms.
Exactly. And because it was early, he managed it with diet, exercise, avoided potentially needing expensive meds long-term, or worse, a major health event later.
That really shows the payoff. What else about checkups?
Well, early detection of serious stuff, like diabetes or cancers when they're most treatable, getting those preventive screenings we mentioned, often free, and just managing chronic conditions effectively, getting vaccinations.
So the sources frame it as a smart financial move, not just a health move. Low cost now prevents high cost later.
Absolutely. And it wasn't just checkups. The material linked overall healthy habits directly to saving money. They cited Gina's story.
What happened with her?
She adopted a healthier lifestyle, better diet, exercise, and found her actual medical bills went down. Fewer colds, fewer doctor visits, fewer prescriptions needed.
Makes perfect sense.
Yeah.
What habits did they highlight?
The usual suspects, but framed financially. A balanced diet, regular exercise. They mentioned that 150 minutes a week, target avoiding tobacco, limiting alcohol, managing stress through things like mindfulness or yoga.
So it's a double win. Feel better, spend less.
That's the clear message. Investing in your health is investing in your financial future when it comes to healthcare costs.
Okay, now what about when you do need a specific procedure, something beyond routine care? The sources talked about engaging with those costs, even negotiating.
Yeah, that part might surprise some people. Negotiating medical bills, it sounds intimidating.
Definitely.
But the sources suggest it's possible and often starts with asking for cash pay discounts. Like shared Laura's story, needed an MRI, big bill because of her deductible.
Right.
She just asked, kind of nervously, do you offer a discount if I pay now? And they knocked $400 off.
Wow. Just for asking, $400.
Yep. So the tips from the sources were, ask directly. Comparison shop prices for the same procedure can vary a lot between facilities.
Good point.
And be ready to negotiate a bit. Explain your situation, maybe mention budget constraints. Sometimes there's wiggle room.
That feels empowering, actually.
Yeah.
What about second opinions? The sources mentioned that too, right? Especially for big things.
Hugely important. A second opinion isn't just about checking the diagnosis. It can open doors to different, maybe less invasive or less costly treatments.
Like Mike's story.
Exactly. He was set for gallbladder surgery, got a second opinion, and they suggested trying dietary management first. It worked. He avoided surgery altogether.
Avoiding surgery is a massive saving. Not just money, but recovery time, risk.
Absolutely. So the benefits listed were confirming the diagnosis, finding alternative treatments, and potential cost savings by avoiding unnecessary procedures or finding cheaper options.
So again, the theme is being proactive. Ask questions, shop around, get a second look. It puts you more in control.
Definitely. And speaking of accessible options, the sources spent time on telemedicine and virtual care.
Which has really taken off.
Hugely. The material used Lisa's example, the busy mom, using video calls for her kids' pediatrician visits, saves so much hassle.
No travel, no waiting rooms.
Right. The big benefits listed were convenience, often shorter waits, and better access for people who have mobility issues or live far away.
But what about the cost angle?
That was a focus, too. They shared John's story. Minor issue. A virtual visit cost him $25. Going to the clinic might have been a $50 deductible hit.
So lower fees up front.
Lower fees, plus savings on time and travel, and importantly, it can help people avoid going to urgent care or the ER for things that don't really warrant it, which are way more expensive.
Makes sense. Easy access for small stuff prevents bigger bills.
The sources definitely position telemedicine as a really vital, cost-effective resource for modern healthcare.
Okay, now shifting to resources outside the typical insurance system. Your material covered community options and government programs.
Yes, things like affordable clinics and community health centers. Really important safety notes.
They mentioned John's experience again.
Yeah, different John. This one lost his job, lost his insurance, found a local community health center. They offered comprehensive care for his chronic condition on a sliding scale based on his income.
That's incredible. Kept him healthy without bankrupting him. What do these clinics usually offer?
According to the sources, often sliding scale fees, so you pay what you can afford based on income. Comprehensive services, medical, sometimes dental, mental health, all in one place. And outreach programs, wellness education.
So vital community hubs,
Yeah.
and beyond those, government programs.
Right. Things people might not realize they qualify for. They shared Sarah's story. Unexpected bills hit. She researched and found out about Medicaid and CHIP for her kids.
Huge relief for a parent, I bet. What were the main programs mentioned?
Medicaid for low-income individuals and families. CHIP, the Children's Health Insurance Program, for kids and families who earn a bit too much for Medicaid but can't afford private plans.
Okay.
And ACA subsidies, the Affordable Care Act subsidies. These help people with eligible incomes pay their monthly premiums for plans bought on the health insurance marketplace.
So the takeaway is, know these resources exist. They can be absolute game changers for access and affordability.
Definitely worth investigating if you're struggling with costs.
The sources also got into specific financial tools, HSAs and FSAs, health savings accounts, and flexible spending accounts.
Yes, these acronyms you see during open enrollment, the material explained them well, using Emma's example with her HSA.
What's the big deal with HSAs?
The triple tax advantage is the main thing. Money goes in pre-tax, lowering your taxable income now. It grows tax-free if you invest it or earn interest, and withdrawals are tax-free if used for qualified medical expenses.
Pre-tax in, tax-free growth, tax-free out for healthcare. That sounds powerful.
It is. Plus, the money rolls over year after year. You don't lose it. It can become a long-term healthcare investment fund.
Okay, so HSAs are for long-term saving. How are FSAs different?
FSAs also let you contribute pre-tax money. But the big difference is they're generally use it or lose it within the plan year. Maybe a small grace period or rollover amount, but mostly you need to spend it.
So FSAs are better for predictable costs, you'll have in the coming year.
Yeah.
Copays, prescriptions, glasses.
Exactly. Good for budgeting those known annual expenses.
And how do you maximize these accounts? Any tips from the sources?
Know the annual contribution limits set by the IRS. Try to contribute as much as you comfortably can, especially to an HSA for that long-term growth, like John in the example. Plan your spending carefully with an FSA so you don't forfeit money.
Right. Don't want to lose it.
And a big one. If your employer offers a match or contribution to your HSA or FSA, take it. That's literally free money for healthcare.
Absolutely. So HSAs and FSAs, definitely tools to understand and use if you have access to them. Real potential for savings and planning.
For sure. They're key parts of managing healthcare finances proactively.
Now, the sources also mentioned a different model of care, direct primary care,
Oh.
DPC.
Yes, this is an interesting alternative. It bypasses traditional insurance for basic primary care.
How does it work?
The core idea, as the sources described it, is you pay a flat monthly fee directly to your primary care doctor or clinic, like a subscription.
A membership for your doctor.
Kind of, yeah. And in return, you usually get much better access, longer appointments, same-day or next-day visits, sometimes even direct communication via text or email. They used Sarah's example, frustrated with rushed visits, found DPC much more personal.
So fixed fee, better access, no insurance hassles for routine stuff. What do the sources list as key features?
Those fixed monthly fees, very transparent pricing, no insurance billing for the covered primary care services, and that enhanced access because DPC docs usually have way fewer patients than typical practices.
Okay, sounds appealing in terms of service, but how does it save money?
Well, Alex's story illustrated that. His monthly DPC fee actually covered things like his annual physical and routine labs, which he used to have to pay for separately towards his insurance deductible.
Ah, so it can lower your overall out-of-pocket, especially if you use primary care a fair bit.
Exactly. Benefits listed were potential lower overall costs, that price transparency, and maybe fewer ER or urgent care visits, because you can get in quickly to see your own doctor for issues.
Interesting. So DPC offers a more predictable, potentially simpler financial relationship for primary care.
It's definitely a model gaining traction, according to the sources.
Okay, let's shift to after you've received care. The bills arrive, the source is stressed, checking those bills carefully, right? Auditing them.
Yes, critically important, because errors happen more often than people might think.
It feels like a chore, though, wading through those statements.
It can be, but it can save you real money. The material shared Tom's story. He got charged a room fee for an outpatient procedure. Didn't stay overnight.
Oops.
He caught it, questioned it, and got hundreds taken off the bill just by looking closely.
Okay, so what are the steps the sources recommended for checking?
Always get an itemized bill, not just the summary total, a detailed list of every charge.
Line by line.
Compare that itemized bill to your explanation of benefits, the EOB from your insurer. Make sure things match up. Look for duplicate charges, services you didn't actually receive.
Okay. Anything else?
And maybe do a quick check on fair prices. Use online resources like Fair Health or Healthcare Blue Book. See if a charge looks wildly out of line for your area.
Good tips. So audit first, but what if the bill is correct? Just huge and unaffordable. Then comes negotiation again.
Exactly. The sources revisited negotiations specifically for bills, acknowledging it's tough, but worth trying. They shared Jessica's approach when she faced a massive surgery bill.
What tactics worked? What did the sources say?
Be prepared. Have the itemized bill, your EOB, know the details, ask for discounts again, maybe for paying up front, or ask specifically about hospital financial assistance policies.
Many hospitals have those, right? Based on income.
They often do, yes. Also, request a payment plan if you need it, and try hard to get one without interest charges. And crucially, stay calm, be polite, but be persistent. Billing departments are more likely to work with you if you're respectful.
So check for errors, then negotiate if needed. It puts some power back in your hands.
It really does. It's about actively managing even the bills you receive.
Now, for potentially really big savings, especially on elective things, the sources brought up medical tourism.
Yeah, traveling abroad for care, it's definitely a more involved approach.
Feels like a big leap.
It is. But the sources highlighted the potential cost savings using Mark's example. Needed a hip replacement. Got it done in Costa Rica for about a third of the U.S. price.
A third, including travel.
Including travel and accommodation, yeah. The savings can be dramatic for major procedures.
How did that work? Why is it so much cheaper?
Lower labor costs in many countries, favorable exchange rates sometimes. Plus, the sources mentioned that facilities catering to medical tourists often offer package deals, including recovery care. And they stress that many top international hospitals are accredited and offer high-quality care.
Okay, quality is key, but there must be risks, right? Big considerations.
Huge ones. The sources were very clear. This requires extensive research and planning. They shared Jessica's approach before she went abroad for a cosmetic procedure. She did serious homework.
What kind of homework? What steps are essential?
Research the hospital and facility thoroughly. Look for international accreditation, like JCI. Verify the surgeon's credentials and experience. Understand all the costs, not just the surgery, but travel, lodging, food, and importantly, what happens if there are complications.
That's a big one. What if something goes wrong?
Exactly. And you need a plan for follow-up care when you get back home. Who will manage that?
So, medical tourism, potentially huge savings, but definitely not something to jump into lightly, requires major due diligence.
That's the clear message from the sources. Viable for some, but plan meticulously.
Okay, wrapping things up, the material you sent brought it all back to overall financial health, long-term planning for these costs.
Yeah, connecting healthcare spending to your broader financial well-being.
Huh?
A key strategy they discussed was having a dedicated emergency fund just for healthcare.
Not just a general emergency fund.
Well, you could combine them, but the sources highlighted the benefit of earmarking funds specifically for unexpected medical costs. Like Lisa's experience, her daughter needed sudden surgery. Having that dedicated fund meant they could handle the deductible and copays without stress or debt.
That peace of mind must be invaluable when you're dealing with a health crisis. How do you build that fund?
The sources suggested figuring out a target amount, maybe your annual deductible plus out-of-pocket max, or 6 months of typical healthcare spending. Then automate it, set up regular transfers to a separate savings account, and review it yearly, adjust as your insurance or needs change.
Makes sense. Automate and forget until you need it. And beyond the emergency fund, broader strategies.
Yeah, integrating healthcare planning into your overall financial life. They use Tom and his partner as an example. They regularly review goals, max out their HSA contributions, use wellness programs at work.
So what were the key strategies listed for that long-term view?
Keep educating yourself about your coverage, benefits, prevention. Actively invest in preventive care. It saves money down the road. Leverage those HSAs if you have them. That triple tax advantage is huge for future savings. And maybe consult a financial planner to help factor healthcare into your long-term goals.
It really sounds like the core message from the sources is be proactive. Don't just react to healthcare costs. Plan for them. Manage them strategically.
That's exactly it. Seeing healthcare not just as an expense, but as a manageable part of your financial life.
Wow. Okay, that was quite a deep dive through all the material you sent. We covered a lot of ground, from why costs are so high, to insurance, meds, prevention, procedures, alternatives like DPC, even medical tourism, and finally, those financial tools and planning.
Your sources really did provide a comprehensive toolkit. Strategies for almost every angle of this challenge, from the simple stuff like generics to the more complex like negotiating bills or planning long-term.
And our hope with this discussion was really to take all that great info you provided and make it feel more accessible, give you that shortcut to feeling informed and hopefully more empowered when dealing with healthcare costs.
Yeah, turning what feels like this huge, scary problem into, well, a series of smaller problems you can actually tackle using the insights drawn directly from your own sources.
Exactly, which kind of leaves us with a final thought, something to maybe mull over based on everything we've discussed from your material.
Okay.
Given how much healthcare costs and the system itself keep changing, how essential might it become to treat a regular review of your personal healthcare financial situation, your insurance details, your bills, the programs available to you as like a core part of your financial health routine, just as vital as, say, checking your bank balance or reviewing your investments?
That's interesting. Directly linking that healthcare review to fundamental financial hygiene. A powerful thought to end on.